Mr. Julien Guillemette has been hospitalized for gallbladder removal. He is very much in pain at the present moment. After preparing the narcotic analgesic, 75 milligrams of Demerol, the nurse goes to the client's bedside to administer the drug into the front gluteus site. Before administering the sedative, the nurse must first assess the client's level of pain using the PQRSTU method and measure his vital signs. He checks in the client's file to know the exact time the client received the last dose. The nurse checks the client's medical prescription and drug administration sheet to make sure the medication is prepared in compliance with the 7 rights of use. When preparing an injection, the nurse writes on the identification label the client's name, room number, name of the medication, dose prepared, the date and time of administration, and finally puts his initials on it. The identification label is then placed on the cap of the syringe to prevent mistakes due to handling. The nurse selects a 1 millimeter syringe and inserts a 1.5-inch 22-gauge needle on it. The nurse takes a 100 milligram Demerol vial out of the narcotics drawer. Since this drawer is always locked, the nurse must punch in his personal identification number to unlock it. He then verifies how many vials are left in the drawer and records that number in the narcotics inventory logbook in order to comply with the narcotics control regulations in force. The nurse makes sure the medication is crystal clear and particle-free. He must also check the expiry date, since expired medication can be chemically unstable and therefore must not be administered. The medical order states that the dose is 75 milligrams. Hence, the nurse uses a cross multiplication to calculate the correct dose to be administered, which is 0.5 milliliters in this case. Throughout the preparation phase, the nurse must respect the 7 rights: the right product, the right time, the right dose, the right client, the right administration route, the right recording on the client's drug administration sheet or medical file, and the right monitoring. Using a quick circular motion, the nurse rubs the vial on a solid surface in order to make the liquid inside it go down into the inferior part of the vial. Doing this allows the entirety of the solution to place itself in the inferior part of the vial and reduce any unnecessary waste. The nurse uses an alcohol swab to disinfect the neck of the vial and lets it dry for 15 seconds. This is done to keep dust and contaminants from penetrating into the vial while opening it. Using his dominant hand, the nurse breaks the neck of the vial. To do so, he uses a gauze or a vial opener to break off the upper part of the vial. To prevent injuries from occurring during the process, the vial should always be broken in the opposite direction to the nurse's body. The nurse places the vial on the medication cart. He picks up the syringe with his dominant hand, removes the needle cap, and places it on a gauze. He then uses his non-dominant hand to pick up the vial, holding it between his thumb and index and middle fingers, and then gently turns it over. To draw the medication, the nurse inserts the needle in the center of the vial, making sure it does not touch its sides in order to prevent any sort of contamination. He must also make sure the needle bevel remains submerged in the liquid throughout the drawing process to prevent the occurrence of air bubbles. Once the medication has been drawn, the nurse removes the needle from the vial and holds the bevel pointing upwards. He then taps on the needle to make the air bubbles move up the needle stub. It is important to pull on the plunger before pushing all the air out because liquid and air generally go up the needle shaft during tapping. Not doing so could waste medication during the final step of air extraction, which is completed by pushing on the plunger until a small drop of medication appears on the tip of the needle bevel. When verifying accuracy, if the syringe contains more medication than the amount prescribed, the nurse holds the syringe horizontally with the bevel aiming downwards to prevent medication from running on the needle and expulses the surplus directly onto a dry gauze. The nurse holds the syringe at eye level and verifies the accuracy of the dose one final time. The nurse locks the safety mechanism in a safe and sterile way to prevent contaminating the needle and affixes the identification label prepared beforehand on the needle cap. In certain situations, the nurse must change the needle. For example, if there is medication on the shaft, if the needle has been contaminated, or if the tip of the needle is blunt. In such cases, an extra 0.1 milliliters must be drawn from the vial in order to extract any remaining air from the needle.
Christine, could I have you come and verify my sedative for me that I've prepared?
Yes.
So here, you'll see, here's my prescription. It's our drug administration chart.
Okay.
And then, okay. We'll just open this. And as you can see, we have that many left. And then the balance, we'll just throw it out, okay?
Okay, that's fine.
Christine, the second nurse, uses the prescription to counter-correct the cross-multiplication made to calculate the right amount of sedative as per the prescription and also the dose that has been prepared. The independent double verification rule is mandatory in cases of certain types of medication that are rated as being potentially dangerous. To fully comply with the narcotics control regulations, the remaining medication and the vial have to be discarded in a biohazard container to prevent injuries. The entire process has to be done before another nurse who will countersign the narcotics inventory logbook in order to testify that the unused part of the medication has been indeed discarded. After the nurse places the material required on a tray, which includes a pair of non-sterile gloves, an alcohol swab, cotton balls, and the syringe filled with medication, and heads to the client's bedside to administer it.